Surprise medical bills: how to ease the shock. Surprise medical bills seem to getting more outrageous by the day. There's the Texas surprise medical billing, when patients receive a bill not covered by insurance through no fault of their own, has affected 57% of American adults, according to a recent University of Chicago. These unwelcome requests for payment most often come after patients are treated at hospitals and emergency rooms by physicians and other medical professionals who aren't part of their health insurance network. 4 out of 10 general outrage over outsized medical charges and efforts to publicize surprise medical bills by and other outlets may have encouraged Congress to engage in one of its few bipartisan efforts. Senators from both parties plan to propose legislation by the end of March to extend protections against unexpected medical bills for insured patients. These efforts may U.S. government action would go a long way to solving the problem. The reason? Welcome as any government action may be, for now, consumers are left to their own devices to avoid becoming yet another surprise medical bill horror story. Hey race, what you check and double check your network. If you know you're headed to the hospital soon for any type of procedure, treatment, or surgery, you first want to make sure the hospital is in your insurance network. More important, it's most common to get surprise bills from an anesthesiologist, radiologist, or pathologist who works at your in-network hospital but isn't part of your insurance company's network, according to research from Consumers Union. The same goes for reviewing your case beforehand with the hospital billing department, or your team of doctors can help make sure you're cared for by providers who are either in your network or agree ahead of time to take in-network compensation for their services. An expensive trip to the ER. Emergency room visits are a major source of surprise bills. In an emergency, for ER cases that aren't dire emergencies and in which you or a loved one are cognizant of broken bone or sprain, for example, or a child's high fever, be sure you head to a hospital that's in your network and ask if attending physicians are in your network as well. Studies show that if you find yourself waking up after an ER visit to a host of nasty bills, you may need to appeal the charges. See the next item. Get help with your appeal. In many surprise billing cases, patients end up filing a formal appeal with their insurance company to get coverage for the charge. In some cases, for help with the appeal, first turn to your physician or surgeon, who can often help document the claim you're making and why you legitimately and unwittingly went out of network. Also check with a nonprofit organization that helps patients with the appeal process. Check your state's regulation. You may also find support from your state insurance regulators. At last count, to find out your state's status on surprise medical bills, contact your state insurance commissioner's office.
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.